So this year at GU ASCO, there were a number of very interesting presentations. One of the ones that I found particularly interesting was a CheckMate 274 study, and that was presented by Dr. Dean Bajorn. And this was an adjuvant study. So it was a randomized phase 3 double-blind placebo-controlled study that took patients with muscle-invasive bladder cancer and randomized them to receive adjuvant Nivolumab or placebo. So the patients in this study were considered high risk in that they had PT2 or higher disease following neoadjuvant chemotherapy, or PT3 or higher disease in patients who had not received neoadjuvant chemotherapy or were considered platinum ineligible. So this is a relatively high-risk patient population where the risk of recurrence is upwards of about 60%. Patients in this study were then randomized, as I mentioned, to receive nivolumab or placebo. Patients were stratified according to nodal status, according to PD-L1 status, and according to whether or not they received prior neoadjuvant chemotherapy. The primary endpoint was disease-free survival in the intent-to-treat population, but also in the PD-L1 positive population. And this study met both primary endpoints. So in terms of disease-free survival in the intent-to-treat population, it was 21 months compared to 10.9 months in the placebo group for a hazard ratio of about 0.70. And in the PD-L1 positive population, the disease-free survival was not reached compared to, again, 10.8 months. And at this hazard ratio was 0.53. So this is really, really exciting and encouraging early data. This was an event-driven analysis, so median overall survival was not yet reported. There were also other endpoints that were important, including non-urothelial tract disease-free survival and distant metastases-free survival. And with respect to both of these endpoints, there seemed to be a benefit to the adjuvant nivolumab group. So all in all, this study met its primary endpoints in terms of both disease-free survival in the ITT population, as well as in the PD-L1 positive population. Importantly, this was a placebo-controlled study, which is different than some of the other studies that have been done in this setting. I believe these results are clinically significant. Of course, we're waiting for the overall survival data, but I think the authors really need to be commended on this important piece of work. And this is a major unmet need in this patient population. So I think all in all, this was a really important abstract, and we'll wait for the median overall survival endpoints to be reported. But I think it's an important one to watch and one to keep in mind. Another important study that was reported this year at GU ASCO was the EV-301 study. So this study, of course, randomized patients to receive Enfortumab vedotin, which is an antibody-drug conjugate, or standard of care chemotherapy. So that's docetaxel, paclitaxel, or vinflunine. And this study took patients who had had prior platinum and prior immunotherapy, which is a patient population that has a high unmet need. This study was actually stopped at the interim analysis because of the benefit seen with the EV arm. In terms of overall survival, it was 12.88 months in the EV arm compared to 8.9 months in the standard of care arm for a hazard ratio of 0.70. And in terms of progression-free survival, it was 5.55 versus 3.71 months for a hazard ratio of 0.61. Response rates 40% or so in the EV arm compared to 18% in the standard of care arm. So clearly, EV has a role in the third-line setting, and it's a reasonably well-tolerated drug. There are some toxicities that we'll have to watch for. This was an important study in the field, and the EV-301 study was published in the New England Journal of Medicine concurrently with the presentation at ASCO.